weeks ago, my husband was legally blind in his right eye. There was no hope. We had no hope.
I feel 100% better. My vision has improved considerably, especially my night vision.
Love this case on eye disease, because imagine being told that you're going blind from a degenerative eye disease, that you couldn't see at night, that you're losing your central vision, and that you couldn't do what you're normally doing, and that the medical treatments were $3,700 a shot, repeated treatments didn't work, and you're only in your 40s. Hi, this is Dr. West and the West Clinic team, and get ready to meet Travis and Jackie and see how our nurse practitioner Shelby helped him to get his eyesight back. And at the end of the video, we'll discuss the treatments that created this clinical outcome. So eye disease meets the West Clinic. Check it out.
Hi, Shelby Stoddard here at the West Clinic with some very special patients, Travis Viles and Jackie Viles. Travis, will you tell us some of your story?
I woke up about 2 years ago and my right eye was pretty much blind. I had no idea what it was. Went to the eye doctor and they said it was an ocular vein occlusion. Went to Salt Lake and had several shots in the eye and did absolutely nothing. So we quit the shots and we heard about the West Clinic from John and Bev Blatter, and we made an appointment. We've had 10 treatments and I feel 100% better. My vision has improved considerably, especially my night vision. It's amazing what you can do just by cleaning the blood.
6 weeks ago, my husband was legally blind in his right eye and was starting to show those same symptoms in his left eye. There was no hope. We had no hope. We had been to the best retinal surgeons supposedly in the country, and all they could do was treat him for macular degeneration, which he didn't have. They told him that he had hardening in the arteries. He's in his 40s. They tested his arteries. There's no hardening. They had no explanation. And to come here and to just be diagnosed, literally diagnosed in minutes in that first session, it's like you knew him, like you read his book. Just looking at his blood cells, you could tell by diet and lifestyle and just you knew what was going on. And in 6 weeks, you would have never convinced me in 6 weeks that he would be driving like a NASCAR race driver, but he is, and so much more confident. And he's eating new foods.
So when Travis first came in, he was just, his color wasn't all there. Your eyes weren't sparkly. You just had loss of that joy in life. And so what we did was we really helped clean up your blood. We gave you vitamins and mineral infusions, different protocols to kind of help really, get you what you need, get that healing in the eyes and the veins, and just really build you up from the cell level out.
It was amazing.
Changed your diet tremendously. So that's, you've done that. So we just gave you the push to do that. And then you were told to try aspirin. They weren't sure if it was going to work, just to see if it would help. But you were on aspirin, so we stopped that because there's really no evidence to say that was going to help. We really mesh alternative medicine and traditional medicine prescriptions, where we really kind of balance the body and we see where we can safely take you off medications or wean off with the advice of your providing physicians as well. But I'm really fortunate to be able to have that knowledge of traditional medicine and now alternative medicine to help people kind of build from the foundation up and feel good.
This stuff is amazing.
Like your eyes are open, you're just got this joy for life. I can see it, and we've seen changes in your blood cells as well. And obviously we use a bunch of different modalities to kind of see your progress and how you're feeling, and it's not just one thing or the other, but it's a really good combination of both. A lot of different therapies and a team approach here at the clinic too. So,
well, and the one thing you did the very first time we were here, and I was so impressed. Every doctor that we've seen so many of them. Mm-hmm. Well, we'll try this, we'll do this, we'll see this. You said right off the bat, we can fix it. And that just gave us so much hope That was the first time in 2 years we had had any kind of hope, And the
Good.
staff here has been lovely. I mean, they're so friendly.
Hey, thanks for watching. Remember, you're not your diagnosis. There's always hope, and the key to eye conditions is to do a couple things. One, improve oxygen flow to the eye, get high levels of antioxidants, and remove sludge. And we did that by using chelation therapy, oxidative medicine, nutritional therapy such as bilberry, vitamin A, lutein, and zeaxanthin. And it's great to help someone out of pain, to improve energy and balance their hormones. But it's hard to be helping someone that couldn't see and now they can see. I sure love going to the office every day. This is Dr. West on behalf of Shelby, Dr. Nelson, Dr. Katie, and Curtis in the West Clinic System. And we'll see you guys on the next video.